Now to our COVID-19 coverage. More states are reporting cases of the Omicron variant. You can see the states with positive cases in this map. California reported the first known case in the entire country earlier this week. 5 new cases were reported in Alameda County just yesterday. Health experts are concerned about the spread of Omicron because it appears to be highly transmissible. However, there's also some cautious optimism. Doctors say as of right now, there are no reported deaths of people who were infected with the new variant. Early data shows people appear to have more mild symptoms if they get Omicron compared to the results from the Delta variant.
If you think about it, any living organism or virus, if you don't consider them to be living, the way that it exists in the future is by spreading and multiplying. So there's more copies of it out there. So it may be, in that sense, a better virus in that it is more likely to spread because it doesn't kill its host right away.
And Dr. Vaughn of Auburn Medical Group says he expects we'll see COVID case numbers go up after the holidays because Omicron may spread more easily. What he and other health experts will be keeping a close eye on is how many of those cases result in hospitalizations or deaths. South Africa has now confirmed more than 3 million COVID cases. That is according to the National Institute for Communicable Diseases. And the Omicron variant appears to be the driving surge there. South Africa reported 16,000 new COVID-19 cases yesterday. And again, that pushed their total over 3 million. Before this surge, they had about 200 new cases confirmed each day. And here's an unusual part of that surge. Children under the age of 5 are being hit the hardest by the Omicron variant in South Africa. Health leaders say that is disproportionately impacting very young children. Hospitalizations for that age group are rising steadily. Those under 5 now represent the second highest number of cases behind adults over 60. Most children who do get COVID end up having mild symptoms so far. The FDA has expanded its emergency use authorization for a COVID antibody treatment for children. Now doctors can use Eli Lilly's COVID-19 combination treatment to treat kids under the age of 12. That includes infants, and the antibody cocktail can be used to help small children with mild to moderate symptoms who are at high risk for severe disease. It has been authorized to treat people ages 12 and up since February. Lilly says it is still trying to determine how well it neutralizes the Omicron variant. 1 month in, the COVID-19 vaccination rate among kids 5 to 11 is slower than it was for older children. That is according to new data from the CDC. The CDC found 1 month after becoming eligible, about 16% of kids ages 5 to 11 have received their first dose. That is slower than it was for older children. In mid-June, a month after kids ages 12 to 15 became eligible, about 27% of that age group had received their first dose. New cases of Omicron variant are emerging in the U.S., and the White House announced on Thursday that they will increase testing because that's going to play a major role in fighting COVID-19 this winter. KCRA 3's Christopher Salas is live in our Washington bureau now. And Christopher, what are health experts saying this morning?
Hey, Leticia, good morning. Some say this is a move that's long overdue, and amid the new variant, increased rapid testing is going to be necessary moving forward.
A new focus in the fight against COVID-19.
There's now a very big push on getting a lot more free at-home testing, which is we really want to essentially flood the system with tests.
The White House says private insurers will soon be required to reimburse the cost of at-home COVID testing kits. And for those without private insurance, the government will buy 25 million tests for community health centers and pharmacies.
There has been a general lack of availability of rapid tests in the U.S., and there are several factors that have led into this.
Lindsay Dawson has been researching testing capacity at the Kaiser Family Foundation. She says those factors include supply chain issues, mixed messaging from the federal government, and a lack of federal investment. That last part began to change in October when the Biden administration announced $1 billion for testing infrastructure.
It is improving, but it is still a little bit spotty. You might not be able to find the test you want at the retailer you want on the day you want.
A group of physicians across the country has been tracking testing capacity, and the data shows substantial increases in the past 4 months. Doctors say it will be necessary amid a projected winter surge and the emergence of Omicron.
I think testing has to be part of the strategies. It can't be excluded. It can't be seen as a novel thing.
And the reimbursement program when it comes to those tests starts January 15th, which means if you get a test before then, you pay for one, you won't be covered under your insurance. Leticia.
And Christopher, can rapid home tests for COVID-19 detect which variant of virus someone may have if they test positive?
Yeah, Leticia, the short answer here is no. While it will tell you if you have COVID-19, it won't tell you which variant you have. Now, in some cases, when you go to a doctor's office, the doctor could send the sample to a testing lab where scientists will then examine the genetic sequence of your sample, and they'll be able to determine what variant you have been infected with. But again, with these at-home or over-the-counter tests, you won't be able to detect it.
All right, that's good to know. Christopher, thank you for your report this morning. While concern over Omicron grows, some hospitals are still struggling to battle COVID-19 infections caused by the Delta variant.
We should remember that 99.9% of cases in the country right now are from the Delta variant.
The U.S. is now averaging more than 100,000 new COVID-19 cases every day. The increased case numbers are putting a strain on healthcare systems. In Michigan, COVID-19 hospitalizations match highs seen in April of 2020. One western New York county declared a state of emergency this week, seeing a dramatic raise in those hospitalizations as well. It is still too early to know if a modified version of the vaccine will be needed to fight this variant. Pfizer says its shot could be adapted quickly for the Omicron variant. It takes about 100 days to develop and distribute a new vaccine. The drug company says anyone who received the current vaccine and a booster should be protected enough against severe disease.